still pretty frozen.
It is, okay. We'll cut them open.
Yeah, you get.
Yeah, I know, I said I figured
Another thing to notice, guys, is one part of the heart that we are seldom taught enough about in EMS is the posterior heart. This is the source of many infarctions as it wraps around the backside. Notice how well supplied with blood it is, though. It has a posterior artery back here that originates from the circumflex and from the right coronary artery. So it has its own blood supply. This block, we have a posterior infarction, which involves primarily the right ventricle.
So this is why the pig died?
No, that's one of the reasons as they were cutting it. Yes. Okay, guys, we're going to start having some fun now. Is everybody located the right coronary artery? Yes. Okay. Left atrium. Is everybody located the circumflex artery? And of course, the left anterior descending. Now, when I say apex of the heart, what part of the heart am I referring to? The point. Yep. The part that points to your left leg. This is the apex. What lead on your EKG looks at this part of the heart?
4, 5, 6.
Well, actually, lead 2 looks right. Everybody look up here for just a moment. When we turn on our monitors, most monitors today, or at least in the past, always defaulted to lead 2 because it's looking at the apex, which in the typical heart is the thickest part of the heart. Now, we're going to cut into this thing in a minute. You're going to see that this is a very thick part of the heart, probably the thickest. So the next thing we're going to do is we're going to start doing some incisions. We've already found the vena cava. Has everybody located this?
Yes.
Okay. The right atrium, which starts right up there with the little red arrow and extends down to where your finger is pointing. Notice that the right atrium is not quite as large as the left. In fact, your finger doesn't have a whole lot of room to move around. I also want you to find the aorta and stick your finger in there. And when you stick it as deep as you can, you realize that your fingertip does not have much room to move around because it's only potential space. Very thick muscle around your finger when you do that. Pulmonary arteries, likewise, as you see in the picture, are coming in from the left side, from the lungs. You should see you see one artery leaving the left atrium, or the left side of the heart going to the lungs, and 2 smaller veins coming back. They're a little bit harder to locate. Has everybody found those? If you look at the top of the heart, this picture is very blatantly obvious. This part of the heart right here is the aorta. Notice how thick it is compared to the almost paper-thin, by comparison, vena cava. You can stick your finger in both of those and find out exactly where they're going.